Hi, good morning. I'm Dr. Tanya Henry. I'm one of the pediatricians with Mariposa Community Health Center. I'm also the head of the Department of Pediatrics, and we are here this morning to talk with two of my favorite people, Dr. Magnuson and Dr. Robles. They're two new pediatricians that have joined Mariposa within the last year, so we're going to be getting to know them a little bit better today. Would you like to introduce yourselves?
Hi, I'm Dr. Elise Magnuson.
Hi there, Dr. Alfonso Robles.
Okay, great. So we're just going to be talking a little bit, just having a conversation, getting to know our new pediatricians so that you can get to know them as well. And so why don't you tell us where you guys are from?
Okay. I moved here from Virginia, and but originally I'm from New Jersey, and then Arizona, then Alaska. So that's not an easy question anymore. But
yeah. Wow, you spent time in Alaska?
Yeah, I did.
Oh my goodness.
About 4 years.
Okay,
Yeah.
awesome. Alfonso?
I am from here. I'm from Nogales, Arizona. I was born in Tucson, though, and I had two sisters already. And then my family just decided to move closer back home, back to my mom's home, because she worked across the line. Yeah.
Okay, that's awesome.
Yeah.
That's awesome. All right. So you guys are obviously pediatricians, otherwise they wouldn't be here talking to me. So what made you decide to go into pediatrics?
Well, for me, it's because I loved working with kids as a resident. It was my favorite rotation. And they just make me laugh, kind of bring out the best in me.
Mm-hmm.
That's part of it.
Yeah, kids are super fun. I agree.
Definitely.
What about you?
I always also had an interest in working with children. I think before med school, well, I guess even before that, I always loved my relationship with my pediatrician, Dr. Rojas, which I'm sure everybody knows here, if not one, the other. And yeah, it was always a fun time talking to him. He would ask me about like how's school doing, how your family, and to me like that was like what a doctor did, and that like what was my idea of what I would become in the future. And then when I applied to med school, I felt like I wanted to do peds, but I had an open mind, and during the rotations I try to keep an open mind, and I had like a system where like on the calendar, like I would do either a happy face, a neutral face, or a sad face for like that day of the rotation, and like pediatrics just had like the most happy faces, so I try to be objective about it as well a little bit. And during the rotation it just made me feel good at the end of the day, so peds.
That's awesome.
Yeah.
That's awesome. I love it. Yeah, no, a lot of us join this career because we just love working with kids. Kids make us happy.
Yeah.
So speaking of training, where did you guys do your training? Like med school and your residency? You don't mind?
Both right up the road for me in Tucson.
Okay.
Medical school in Tucson, then residency there.
Okay.
Yeah.
Okay, awesome. Awesome.
Wow.
Yeah.
I did med school also at the U of A, and then residency in Loma Linda, California, which just recently graduated from. So this is my first job outside of residency, so please be nice to me, everybody.
And Alfonso also rotated with Mariposa as a medical student. That's where we first got to know him, and then he came back and we were super excited.
That's true, and it's good to still see that the program's still going on. Like there's still students coming in, and it's like it kind of feels good. Like it's one of the first ones.
Yeah, I love it. Yeah. So after you guys did your training and different things along the pathway, what was it that made you decide that you wanted to be here in Nogales? Like how did you decide to come to Nogales?
Well, for me, I still have family here in Arizona, not here in Nogales, but I was looking to come back to Arizona for a while. It was like part of the long-term plan is to get back here eventually. Then different family things came up, and I thought I'm ready to move back now. So I started looking into available jobs, and Mariposa was hiring, and the interview with Dr. Williams was awesome. The trip down here to meet everybody was terrific. It just seemed like it was like a great opportunity that I didn't want to pass up.
Yeah.
Yeah.
And we're glad that you didn't.
Thank you.
Alfonso?
Yeah, I guess it was like pretty easy for me. Getting closer to graduation, I was looking like, where do I want to work? And I, having rotated here during my third year, I just gave Dr. Williams a call. I was like, hey, are you guys looking to hire? And he's like, yeah, come on down. And I drove down like in 2 days after that. I think it was like near Christmas break, and it was worked out. I saw everybody again, and yeah, it was, happened pretty quickly. But yeah, I obviously my parents still live down here, and it's nice to spend more time with them as an adult, right? Like, although they still sometimes treat me as a kid, so I feel like sometimes I'm the patient again. No, I've enjoyed my time here again and getting to refamiliarize with myself with how Nogales has changed and how it hasn't, and but the people like still like that. Ultimately, that hasn't changed. Like I still feel at home here. Yeah.
That's awesome. We're glad you decided to come home. So since you guys have been here working in Mariposa, so tell me, when did you start, Elise? When was your first day at Mariposa?
It was early October.
Okay.
I can't remember the exact first date, but roughly October 4th.
Okay, 2021.
Yes, that's right, 2021, exactly.
Okay.
Yeah.
All right. And Alfonso?
Yeah. I think it was September. Yeah, 2021 as well. I think we started around the same time, and then October maybe full time, because I had to study for boards, which that went well, and yeah.
Okay,
So,
awesome,
yeah.
awesome. No, that's great. And then since being here, what are some of the things that you absolutely love about living here, working here?
Oh, for me, one thing I noticed right away is that the people in general are much friendlier and kinder than other places where I've worked. So that's something that I've really come to appreciate, friendliness. And the family values are really pretty cool.
Yeah.
That people have close-knit families, extended families. That support system, I think, is so key to raising a child.
Right. It takes a village, right?
Yeah.
Yeah.
Exactly.
Yeah. Yeah, totally. I agree with that. And then, like sometimes when you're talking to a family or patient or in med school, they teach you like, okay, you do your HPI, and then you do like your review of systems, and then you do like family history, social history. But sometimes you just go like straight to social history, like in visits, like how's the family? Like, how many brothers do you have? How many sisters do you have? Like, who do you know? Blah, blah, blah. And like, it's important information, and it's also just an icebreaker that you kind of get here. Sometimes you wouldn't get other places. And yeah, like I mentioned, I'd like to see how Nogales has grown, changing new stores, and streets look nice, although there's some issue there initially with a lot of construction. But yeah, I've even I've ridden my bike once to work, and I'm excited to try to ride it more, and just it just feels like a nice place to live again.
That's awesome. No, we're so glad you guys are here. I think that's so cool. Now, let's move on to just pediatrics in general. I just want to know, I know you talked about how you love working with kids, but what are some of the things that you absolutely love about working with kids, and what are some of the things that you maybe don't love?
You want to go first?
Well, yeah, I think we're talking about our favorite ages. I won't say one particular age to to isolate them, but I think in general, early childhood is when They have like a lot of great stories, and they just like come in and they don't know like why they're here to see the doctor, but they just start talking about their day and like what they love to see on TV and their favorite doll, and it just like makes me laugh. And it's just like, I'm sometimes trying to get to the bottom of like, why are you here, and like, let me fix you, but it's nice to know that they're not really sick sometimes, and that it's okay to like take a laugh, like to laugh a little bit during the day. And so I guess that's my favorite part. And least favorite part, I think it's just I think here is unique in that we live near the border. And there's a lot of opinions about how to treat our patients, and they're not all wrong, but ideally it'd be nice to eventually build a nice relationship with your patients where they come to you first, and like, so you can manage it from the start to the end, where sometimes they come in like, oh, I've tried this and I've tried this and that, which is fine. Like, we work with it. We meet them where they're at. So it's just I would say an inconvenience. I wouldn't say it like and it's a learning opportunity. It's like a time where you can like talk about, like try to explain to the family more, like, maybe you shouldn't do this, or maybe try this first, etc.
Yeah, no, I mean, working at the border is a truly unique opportunity, and in some ways it's great that our patients have opportunities for healthcare on both sides of the border. I think that's amazing. It's also nice that we have the opportunity to really build relationships with our patients, and really build up their trust. And so one thing I would just want to speak to everybody who's looking at this video is that never ever be afraid to come into the clinic. It doesn't matter if you've gone somewhere else. It doesn't matter if you started treatments. Your primary care doctor is always going to be there to help you out and to kind of go through those medicines and to speak with you and answer questions that you have about what's been going on with your health condition. We're always there. Also, we are open on every Saturday between 9 and 1 for walk-in visits. Just to let people know, because some people don't, but Mariposa is open every Saturday except for major holidays between 9 a.m. and 1 p.m. for walk-in visits. So if your child is sick, it's a Saturday, don't worry. You can come in and see us. We're happy to see you. The other thing I want to stress is Mariposa also has a nurse triage after hours line, which is amazing. So even after the clinic closes, if you are worried about your child, it's 2 in the morning, they have a fever, they're vomiting, you can call the clinic. You can speak to a nurse who's trained, and she can answer your questions, or he can answer your questions and direct you what needs to be done. So never be afraid to contact us. We're here for you. Okay. All right, Elise, what are some of the things that you love about pediatrics? What are some of the things that maybe you love less?
Okay, so what I love about pediatrics is just that I get a chance to see so many different children and teens, the whole spectrum of ages, and in that spectrum there's always somebody who it just lights up my day. It could be, like Lafonso said, a funny story of just a typical day, and for a typical kid that's just entertaining and adorable. That's pretty cool. I also like the opportunity to reassure parents, because at this part of working in pediatrics is obviously working with parents, so you kind of get the whole family experience. And as a mother, I mean, I kind of come across it. I have that angle that I bring to the experience, like just knowing that, parents obviously are going to be worried, and sometimes it takes a few extra words to reassure. Because, a lot of times after practicing for as long as we have, we know right away that this, might not be a serious illness, but in the eyes and minds of the parent, it could be. So it takes a little extra conversation sometimes, and I would say that is part of what I enjoy, is to try to reassure parents that everything's going to be okay, or in the situations where it is more serious, to try to be there for them, as an advocate for their child throughout the process of getting the diagnosis and coming up with the right treatment. Just trying to get them through that process of dealing with that uncertainty and that worry. That's very rewarding. So as far as what's like the more challenging would be, sometimes kids are so fearful when they come to the doctor that there's nothing you can say or do or cajole them into calming down. So you have to do an exam with a screaming, fighting child. That's obviously a big challenge, and you don't get as good of an exam that way. But it just comes with the territory. It's it's not something I enjoy doing. It's just part of the job. I guess that's about it.
Yeah, no, I totally get that. As a child, I hated my pediatrician. I was so scared every visit. I remember once I had to get a throat culture done. You guys know what I'm talking about when they swab the back of your throat. Oh my goodness, I think it took 3 nurses to hold me down. And now I'm a pediatrician. So parents, don't worry. All kids go through these stages. It's completely normal. I know some parents are telling me, I'm so sorry. You don't need to apologize. This is a normal developmental stage. And at some point in time, we're actually reassured that your child is fighting us because it means that they're not so sick. And it means that they're at the right developmental stage. One thing I wanted to talk about, and I'm glad that Dr. Robles Alfonso brought it up, talking about early childhood. That time is so important and so special. And that is a time that we actually love to see your children, not just for vaccines, although that's important. Every time we see your child for a well child check between the ages of 0 to 6, we're always checking their growth, we're checking their development. We're able to answer questions that you have about those developmental stages, such as the picky stage, the tantrum stage. We're there to kind of be your support, as Dr. Magnuson said, to be your advocate. As Dr. Robles said, we're there to help educate you. We're here to just be your support and your backup to make sure that everything's going smoothly and that your child is developing the way they need to be developing. And so definitely remember those early childhood well child checks. We would love to see you for those at 0, which is the newborn, 2, 4, 6, 9 months, 12 months, 15 months, 18 months, 24 months, and then it's yearly. We give you a break, okay? And so yes, don't forget about that. And even when kids get older, it's still important for those yearly checkups, especially in the school age years. Middle school can be a hard time, high school can be a tough time. And so definitely we would love to see those kiddos yearly. So yeah, speaking of that, and then I'm going to stop talking because I want you guys to hear more about Dr. Magnuson and Dr. Robles. But during those school age years, super important to get those yearly physicals. And our yearly well child checks at those age will also qualify for sports physicals. So if your child needs a sports physical, you don't have to wait until August. You don't have to wait until they're about to go back to school and you're stressed and the child is stressed. We are doing physicals all summer. Dr. Magnuson and Dr. Robles have lots of available slots for physicals, as do the rest of us during the summer. So I strongly recommend that if your child is going to do sports, or even if they're thinking about doing clubs, band, things like that, definitely set up an appointment during the summer. Don't wait till August. We are happy to see you now. All right. And so, question for the two of you. Are there certain things after being here, for the past 7 or 8 months for Alfonso, and after practicing for how many years have you practiced, Elise?
Oh, I lost track. 20-something, 22.
22 years.
Yeah.
What would you say are some of the most important things that you would want your families and your parents to know? Like even before they come to you, what are some of the things that you would really want to impart to them?
About the visit,
sure, about the visit or the importance of well child care, or what you feel that you can offer to them. What would you love for them to know about you and how you practice?
Oh, okay.
Sure.
Okay. Well, one thing that I like people to know is that I'm pretty open-minded. Like I know there's many controversial subjects regarding healthcare these days. Vaccines are probably number 1 on the list. And I like to respect people's opinions and approaches to vaccines. I have my own opinion, but I don't like to force that on someone or to shame them into thinking they're doing the wrong thing for their child. I'd like to keep it open so we can have a conversation. So I could offer my point of view, but also so they know that if our points of view differ, that I'm still there for them to provide health care. And that's one thing that I'd like for people to know for sure.
It's so important.
Yeah.
Yeah, I agree with that. I want to keep an open mind, but I think I try to mention it now, and I think we're doing a good job at promoting it in the clinic. Is about just like reading to your kid, reading to your child, your baby. I think that's the biggest investment you can do for your child. Yeah, like the human brain grows the most in like the first 2 to 3 years of their life. So I think the more you talk to them, read to them, just get it like a relationship with books is super important, and a good investment for their education and career. So aside from like healthcare and medicine, like I think that is important. Like your education is super important.
I completely agree.
Yeah.
And just to let the families out there know, Mariposa is part of a program called Reach Out and Read. So we will provide your child with a free book for every well child check they come to, every physical between the ages of 6 months and 5 years. So come on in, we'll give you that free book, and we give toys as well. And stickers.
One of the best parts.
Yeah. So I agree. Let's see. I'm trying to think if there's anything else we need to talk about, anything else we need to cover.
I'm curious, like I have a question for you, I guess.
Sure, all right.
You just gave a lecture about health on the border.
I did.
Maybe I haven't gotten a chance to see it yet. Maybe you can give us some highlights about what it's been like for you and what, how is it, what's interesting about working here versus anywhere else?
I did. I actually did just give a lecture at one of the pediatric conferences at the U of A on border medicine, and I got to highlight Mariposa Community Health Center and all the awesome things that they have done for with the community, since they've been in existence. And I think one of the things I would have to say is practicing medicine at the border is unique, and it is an opportunity to really improve people's lives and really improve your own life. Sorry, I keep touching my microphone. I'm not supposed to do that. I think there's a lot of challenges to working at the border, as the families here can attest to. I think one of the biggest challenges we talked about in my talk was access to subspecialty services. I know a lot of times when I'm in the process of placing a referral for my patients, one of the biggest questions people ask is that appointment here in Nogales? And much of the time I have to say, no, it's in Tucson. And that can be really hard for our patients. Sometimes it's hard to have transportation. That's the biggest thing, transportation. To get up to Tucson, sometimes it's having difficulty crossing the checkpoints, the borders, for whatever reason. This is a reality that we have here. What I love about Mariposa, though, is I feel that it's done a good job at being able to help draw subspecialty clinics here. I know, and the subspecialty clinics in Tucson have done a good job of reaching out to us as well. We do have a pediatric cardiology clinic here in Nogales once a month. That's great. We have a general surgeon who is able to see children, I think, from the ages of 6 to 8 and above. Dr. Stinnett, great, a surgeon with lots of expertise and lots of years of experience. We have ear, nose, and throat, otorhinolaryngologo, which is a really long word, but ear, nose, and throat, that we have here locally with Dr. Imami and his group, that have clinics here locally, which is great. We have Dr. Klein, orthopedist, who also sees children up to a certain age. And so we are also now doing telemedicine consultations. So for instance, we're able to do dermatologic telemedicine. I think we're able to do rheumatologic. There's different subspecialties we're working on. Don't quote me on that, on the total list, but it's an evolving program that we're working on. And so I think working at the border gives us a real opportunity to come up with solutions that will work for our patient population. I mean, as Alfonso and Dr. Alfonso and Elise said, we are here for you. You know, we came here for you. We came here to help, to provide services, to advocate for you. That's why we're here. And we want you to take full advantage of us because that's why we're here. We're here for you. So I'd say, you know, that's kind of one of the challenges in a nutshell.
Awesome. Agreed. Totally agree.
Yeah. So I have a question. Did you guys have any concerns about coming down to the border? And if so, how did you get past that? Just for my own personal experience, I came from Massachusetts, and when I was coming down, USA Today had just done a big set of articles on life on the border, and actually, and I was very interested in it, and I realized that being here in Nogales would actually be safer than where I was living in Springfield, Massachusetts. You know, living on the border is so safe compared to lots of other places in the US, actually. That combined with the opportunity to interact with people that love families, that are so welcoming. I mean, it's been a huge, great opportunity for me. But go ahead.
I definitely agree with you. I didn't have concerns about safety when I moved here, not at all. So that you're right. There's so many places in the U.S. that are much more dangerous to live, and we can't take anything for granted, no matter where we live, unfortunately. But I've never felt a concern about that.
Yeah.
Yeah. Growing up here, I knew what I was getting myself into. I didn't have any concern for safety. I think it was just like weighing different options at that time, and Nogales is a good fit. It was a good fit for me.
Yeah. That being said, we are so happy that Elise and Alfonso, Dr. Magnuson, Dr. Robles have joined the Mariposa family. We hope that you will get to know them. And just to let you know, they have plenty of available slots open, and they are both taking new patients. They are both rounding in the hospital, taking care of newborns. And so they are excellent additions to the Mariposa team, and I really hope that you will find the opportunity to get to know them and make them part of your family.
Thank you.
Thank you.